To stay active, Florida resident Robert Garrity likes to take advantage of his neighborhood amenities.
I live in Lithia, Florida. The development we live in has a lot of nature trails. We like to go out walking with the dogs.
He describes how his low back pain developed over time and a spinal anomaly that contributed to his condition.
My pain was due to, actually I found out later, two different things. One, when I was younger, I had a lot of manual labor-like jobs. Drove a milk truck, which was a lot of lifting and bending. You know, when I'm going to a convenience store or a restaurant, they're getting multiple crates, so it's a couple 100 pounds on the hand truck. After that, I worked at a tire warehouse with truck tires that weighed a couple 100 pounds. And then I found out after going to Bonati that vertebrae that fuse to form your sacrum, the top vertebrae didn't fuse, so I actually have an L6, whereas most people only have 5 lumbar vertebrae. And that extra vertebrae was kind of causing a problem.
As Robert's pain worsened, it radiated down his leg into his thigh, making everyday tasks all the more difficult. Until one morning, his wife Randy intervened.
I had always had pain in my lower back, like dead center on my back along the belt line. I tried a lot of different doctors and everything, could never really get a whole lot of relief. I'm allergic to morphine, so a lot of the painkillers really don't work for me. When I changed careers later in life and I got a desk job and I was sitting for long periods of time, it went from just being a pain in the middle of my back to where I'd actually get numbness and burning down the side of my leg. And tried chiropractics, I tried massage therapy. My wife even got me to try acupuncture, and they all worked to a certain extent, but they got less and less effective as time went on. It got to the point where I bought a pair of slip-on shoes because I was having trouble bending over to tie my shoes. And you know, making all these little adjustments rather than actually addressing the problem. My wife is Randy Hughes. She actually had a surgery at Bonati first and had a really good experience. So when I started having back pain and issues, she got tired of hearing me complain and said, you just need to go to Bonati and get them to look at it and get it taken care of once and for all. There was one day in particular where I woke up and I told her I can't move, my back is hurting, my leg is totally numb and burning. I can't even get out of bed. And she's like, I'm calling today. And they were actually able to get me in. They said, we have a 12:30 available if you can get up here. And so we were able to make it up there, and I was seen the same day, where that's unheard of with any other kind of doctor. I mean, I can't even get the chiropractor the same day.
Consultation day at the Bonati Spine Institute is a thorough process. Guests are guided by the helpful staff along the way, and a one-on-one consultation with the surgeon ensures all questions are answered.
One thing that I've always been amazed by is how thorough they are. It says you start at the clinic and then you see the nurse. They told me I'm going to need an MRI and x-rays, and it's across the parking lot. So you walk, like a couple 100 feet and there's the imaging center. I didn't have to make an appointment and wait a couple of weeks and then wait for a couple of days to get the results back. I walked across the parking lot. They got me right in for the MRI. We walked 2 doors over in the same building and we got the x-ray. We walked back to the clinic, sat in the waiting room for about 10 minutes. Then they called us back. They had the MRI and the x-rays on the computer. And I got to sit down at that point with the doctor. And he's looking at my MRI and x-rays. And he's showing me where the spinal canal was narrowing. And he's like, that's what's causing your leg numbness. And he showed me they have these little models of the spine. And he showed me how all of the vertebrae at the bottom were fused to form the sacrum. And he's like, there's 5 here. And then he shows me on the x-ray, you have 4 and this one's floating. And he's like, that's causing another one of your problems. And then he proceeded to show me what they were going to change on the x-ray. He said it was spinal stenosis. And he said that we're going to, widen the spinal canal, and that's going to provide some relief on the spinal cord. And also, when I would work out and I do any kind of crunches or sit-ups or anything, I always felt like there was this scraping or grinding in my back. And when he pulled up the x-ray, I had 2 big bone spurs on my spine that were actually scraping the vertebrae above. He said that, they would take care of those as well, so that would make it easier for me to bend and move.
Robert had one Bonati spine procedure in September 2019.
The day of surgery, the nurse came out and had me verify my name and what surgery I was getting. Then they walk you back in the room. And while they were prepping me for the IV, the anesthesiologist came in and told me what they were going to be doing, told me about the conscious sedation, and said that once the doctor gets in there and he's going to ask you some questions. And when you first hear that, it's like, okay. I admit I was a little nervous about it. I was more alert than I thought I would be. And they asked me if I was feeling any pain. I said no. And then they told me they were going to start with manipulating the nerves. And he's like, I'm going to move a nerve and just tell me foot, leg, back, butt, wherever. And they'd move a nerve and I would tell them foot, leg. It was a cool experience. Most people, when I tell them that, they think I'm crazy, but I thought it was very interesting that I was awake. They were poking around in my back. I didn't feel anything other than a little shock when they moved the nerve. Other than the incision pain, I didn't have any back pain. My leg wasn't numb. It was like immediate relief. I was in the recovery room for, it seems like 20 minutes later, I was up walking out the door. I'm sure it was longer than that because with the anesthesia, time seemed to flow a little funny, but I was amazed that I walked out of the surgery and felt 100% better than when I walked in.
Surgical guests can feel results instantly and know the procedure was successful before leaving the Bonati Spine Institute.
My recovery has gone a lot smoother than I thought. The only restrictions I had, of course, were, couldn't really lift anything the first couple of weeks. They want to keep bending and twisting to a minimum because, again, they don't want you to put stress on that area. But other than that, I was able to walk with no issues, and I was able to walk extended periods of time. It wasn't 5 minutes here, 5 minutes there like I was expecting. I was able to go grocery shopping and walk up and down the aisles for 30, 45 minutes without having to stop because my leg was bothering me. We have a 2-story house. I was able to maneuver up and down the stairs with no issues, which I wasn't expecting to do the first week out of surgery, but within a couple days I was able to up and down the stairs, no issue, and just back to everyday life without really a whole lot of restrictions.
Due to their patented tools and techniques, the Bonati spine procedures offer a significantly faster recovery time when compared to any other spine surgery.
Your back pain can be solved quickly and fairly easily. I know after going with my wife the first time and just seeing how easy it was for her, I've been telling people, if you have back pain, it's worth the consult to see if it's something they can fix for you. From the minute you walk in and they walk you through all the steps, it's all self-contained. So when you leave there, you'll know if they can help you, what they're going to do to help you, and when you'll be able to do it. Most of the people that, I tell that to, they're amazed that you could be up and walking around the same day and you can feel the relief within a couple of hours of the surgery. I probably should have taken my own advice because I probably put mine off longer than I should have. And now that I've had the surgery, I'm thinking to myself, if I would have done this, a year ago, 2 years ago, I wouldn't have had to miss out on the different things I missed out the last couple of years.